Hi, welcome to part two of our discussion with Robin Hackney on the incredible world of digital health. We're recording this in 2023, and Robin, I have a feeling we're gonna have to talk again in a year, if not sooner. Um, we're looking at this amazing array of technologies and ideas and solution areas that people are addressing, but I know you want to dig us into some of the details, so let's jump ahead.
Yeah, absolutely. Thanks for having me back, Peter. As I was mentioning, because of the influx of solutions, there are just so many different types of solutions in the digital health domain. And so it's hard to get your arms around them as someone who doesn't live and breathe this. And so I wanted to give you a tool to help think about that, and B, give you an introduction to some of the biggest, most important ones. So if you think about clinical, operational, and financial, most solutions fit into those categories. Some cross the boundaries, and we could have big debates about what fits where. But for instance, your health sensors and trackers are generally going to be clinical. They're dealing with the actual health information. Your remote patient monitoring, I'll talk a little bit more about that one. Whereas your operational ones, if we're analyzing the data and pulling the information out, or your privacy and security, those are things, HIPAA, we've all signed those HIPAA acknowledgments, right? Well, managing against HIPAA is a digital health solution, and that's very operational. And then on the financial side, while of course digital health companies have quite a bit of financial data that they need to manage, just like any business, there are also some nuances there, like benefit management or something that we call revenue cycle management. And so I'll take you through a couple of examples of the most common digital health solutions to help folks who aren't familiar with digital health really understand. So I picked out six to give us an understanding of what these are. And the behemoth of all of them is in the upper left-hand corner here, electronic health records. And probably most of your audience has heard of EHRs, EMRs. This is replacing those awful file folders that you see in the image there. And we've digitized the medical records. And pretty much every medical institution has done that at this point. We're at 97, 98% have adopted an EHR. And there are, I think, over 500 different vendors who offer electronic health records. But the big names like Epic and Cerner are ones that a lot of people know. But there are a lot of nuances. So, dermatology has a nuanced specific version. Your senior living facilities or nursing homes have their own version. But these really help just maintain all of the data so that we can track it and we don't have these growing massive file folders. And it allows for easier communication between doctors and staff, doctors and doctors, and doctors and patients. So everything else in the digital health realm, if it goes through one of those providers, generally needs to plug into the electronic health record.
Great.
Okay. Next one I wanted to hit on is telemedicine. So if you think of the electronic health records as the behemoth that everybody has, and it's sort of the old school, telemedicine is new school. It's been around and we've talked about it for many years, but with the pandemic, we really saw massive growth in telemedicine. Something like 70% of medical visits were done using telemedicine during parts of the pandemic. That usage rate has obviously decreased, but now all those healthcare providers actually have telemedicine available. We as patients are familiar with using telemedicine and the benefits associated with it. So we've seen really fabulous opportunities. It allows us, if we've got a mobility issue, maybe you broke your leg, you don't actually need to go in and see for the checkup. You can have the report and you don't have to figure out how to navigate getting to the doctor's office. As well as if you need a specialist and that type of specialist isn't in your area. Now telemedicine opens the doors for all of those people. Now there are some challenges that come with that. I'll save that for later.
Just
And then
a sidebar on telemedicine. We have a family member who was in for an issue at Bridgeport Hospital, which is part of Yale New Haven. And all of a sudden on the screen in front of her, was a specialist from New Haven asking her questions about her history. So that's
Mhm.
a level of telemedicine I hadn't heard of before, but sort of at a new level.
That's a great example, Peter. And we see that a lot in rural health areas as well, because when you live in a rural community, it's a lot harder to get access to those specialists. And you can use telemedicine to bring them in. So you're in there talking to your generalist, your PCP, and they bring in the specialists so that you can get the care that you need and deserve without having to, fly off to somewhere or drive for 4 hours.
Right?
So it's really amazing.
Yeah.
Um, Patient engagement, I hit on a little bit in the last session, but it goes in a bunch of different ways. Patient portals. Hopefully, everybody listening to this has a patient portal with their primary care physician. They might have 3 or 4 others, depending, but getting your information in and being able to communicate with your doctor that way is really convenient. And by the way, it gives you access to your test results. It's basically your view into the electronic health records. But there's also other patient engagement tools, website chat. You go to the provider's website and you can chat with them. That's a form, or texting. So I used to work for a patient communications company, and we had texting that was actually conversational. So not just, yes, I confirm I'll be at my appointment, but hey, by the way, I forgot my prescription. Can you call one into the pharmacy down the street while I'm on vacation? So all sorts of things, the admission forms, things so that you don't have to repeatedly do those painful exercises associated with visiting the doctor. So I won't go any further into patient engagement, but it is a passion area for me. Similar though to patient engagement is wearable technologies. I've got my Fitbit on. Many people have your basic wearables. They go much beyond fitness trackers and smartwatches. But there's all sorts, like your blood oxygen monitoring or blood pressure cuffs. A lot of people adopted those during the pandemic as well. And they can really help people stay healthy as well as monitor a chronic condition in order to make sure that if they need to go see the doctor, they can. Sort of the flip side to wearables is remote patient monitoring. And so if the wearables is something that I, as the patient, most likely choose, and I'm the one seeing the data and I have to take action to share the information with the physician, with remote patient monitoring, that's something that is essentially prescribed by the physician. So maybe I'm a diabetic and they really want to watch my A1C levels. They can prescribe a device, or perhaps more importantly, maybe we're talking about a patient with a heart condition, and so they want to monitor what's happening to your levels as you go. And so they can figure out, and then maybe you're keeping a diary as well. Oh yeah, I was on the treadmill during this time period. Okay, I can see what happened to your heart rate. So interestingly, and I was surprised that it was this high when I looked up the stat, 30% of physicians today are using remote patient monitoring. So that was surprisingly high to me. I don't know if that struck you as strange, Peter.
Seems high, but that's great.
Yeah. And I think there are a lot of things that we don't even think about as RPM that that fit, and that's how it gets so high. But it's really useful, particularly for individuals who have a chronic condition, regularly monitoring and supporting them so that they can control that condition. And then the last one I wanted to hit on was revenue cycle management. We probably don't think about this very often, but medical facilities often operate on very low margins. We talk about things like a 3% margin. And it's hard to believe because, we see these fabulous buildings and we pay these giant bills, but there's so many moving pieces and parts to that, that when you really look at the books, they're operating on those small margins. And particularly since COVID, the dynamics have changed a little bit. And so it's really important that they capture all the dollars they earned. And we can think about revenue cycle management in two parts, because there are really two people who are funneling money into the physicians or the healthcare providers. You've got your insurers or your payers, and then the individuals. And so it's revenue cycle management, or RCM, helps the healthcare providers get the codes right for the insurers so that they can get paid properly, and then also figure out the right timing and communication and transparency for the patients. Because when you get a bill that you had no idea what it is, why you're getting it, most people don't pay those. And that then goes into those low margins for those healthcare providers, because then they have to spend all that time chasing it down. And so RCM, whether you're talking about a service or a technology-enabled service, that really helps make sure that those healthcare providers are doing all the right things to capture the dollars that they've earned, so that we don't have to pump up dollars and overcharge for something because they're capturing the dollars that actually should be captured.
Right. We've now done another 10 minutes very quickly. So we're going to take a break and we're going to come back for part 3.
Awesome. Thanks, Peter.
Really, it's really great and comprehensive, and I really appreciate the overview.
Great.